Good afternoon, everybody. Today I will discuss little bit of the procedure of thyroid fine needle aspiration biopsy. I have prepared some slides to describe all these procedures. Now these are the FNAC biopsy equipments which are required for the thyroid fine needle aspiration biopsy. These are mainly number one is alcohol wipe, 4 into 4 inch gauge pads, 10 ml plastic syringe, 27 gauge 1.5 inch stiff non-cutting bevel edged needles. Number 5 is needle which are spinal needles. Number 6 are some glass slides. Number 7 is alcohol bottles, and number 8 a special type of mechanical syringe holder which is known as piston grip mechanical syringe holder. This is a special type of syringe holder you can see. So these are the biopsy requirements of any equipments for the final thyroid biopsy. Now these are the mainly the position of the patients during the final aspiration biopsy and the procedures. These are the 4 pictures A, B, C and D. Now A picture shows the position of the patient during the final aspiration, which is mainly the supine position, and the pillow under the patient's shoulder allow the hyperextension of the neck and the maximal exposure. And B showing the syringe and this piston grip needle holder. And these are the procedures where the nodule, this is a nodule which is identified and stabilized by the operator's non-aspirating hand. This is the aspirating hand and this is the non-operator's aspirating hands. And by this we can stabilize the nodules to get the maximum amount of FNAC biopsy specimen. And this picture shows, the D picture shows with a quick motion the needle is passed through the skin and enter the nodules, and immediately mild suction follows. As soon as the aspirate appears, suction is released and the needle is withdrawn. So these are the procedure of FNAC of the thyroid gland. Now the next slide is, after taking the aspiration we have to prepare the glass slide. These are the procedures. The needle is quickly removed from the syringe, the first procedure. Second procedure is the 5 ml of air is aspirated into the syringe and the needle is placed back on the syringe again. And then on the third area we have the needle bevel facing the down, and the 1 drop of aspirated material is expelled into the each several glass slides, and the glass slides are labeled and placed on the table before the aspiration, ready for the use. Now on the D picture we can see that with the second slide the smear is prepared in a manner similar to that of the blood smears, and the slides are then immediately weight fixed by the placing them into the alcohol bottle. Now these are the special situation where you can see that 3 to 6 aspirations are made, mainly 8 to 10 slides are made from the each nodules. Preferably, the important thing is that preferably the aspirates should be obtained from the peripheral areas and the different parts of the nodule in a sequential manner to ensure the representative sampling. For the larger nodules, the deep center of the mass should be avoided because it is more likely to contain degeneration of the fluid and decreasing the chance of the diagnostic specimen. For cystic lesions, the fluid should be completely aspirated and FNAC attempted on the residual tissue. The aspirated fluid should be placed in a plastic cap and saved for the cytological evaluations. Now these are mainly the pictures showing after the FNAC. Immediately after the FNAC, firm pressure is applied to the biopsy site. Then when the procedure is finished, an adhesive bandage is applied and the patient is asked to sit for the observation for a few minutes before leaving the center. These are the procedure of the FNAC. Now what are the complications? Now FNAC biopsy, particularly under the ultrasonography guided FNAC, is very safe. No serious complications. The needle puncture causes slight pain and some skin discoloration at the aspiration sites. However, even a minor hematoma is uncommon. But patient who uses the anticoagulant